In pai tato tai pai kung sun shan cho sanin cho loko ti chi in ling chuan chu hai. So till chu hai is the 10 point. Then the 11th point is the chi men chung men fu shi fu chi ta heng fu ai shi du tian si xiang xiang zu rang tapao. These are the total number of the points. मैं कितना गोरा दिख रहा हूँ नहीं?
सर चाइना में ऐसा गाना गा गा के सिखाते हैं सर।
मैं गा डालता हूँ सर।
One tune sir.
Yeah. Half tune ऐसा देना ऐसा देना तुम लगाते हो you just apply.
Clinic he will apply no sir.
Yes, good, very good, good enough. Now we would like to see totally 21 points. Among them, the first point is the in-pi point. That is the first point of the spleen meridian, where the point 1 chun proximal to the medial corner of the nail base of the great toe, the point is located here. So we already applied this, the number 1 point. This is the specialization point to be known as a wood point. And also this point is great point to treat for the connecting point to the liver, and then the spleen related problem can be treatable successfully when the liver spleen 1 is equivalent to the liver 3. So liver 3 is the grandson point and spleen 1 is the grandmother point, to making the equilibrium in between the liver and then spleen together. We can activate this point. By the way, where you are applying, that's really very important. Which side you want it to apply, that also matters. Whether you are applying on the left side, then you are treating to the lymphatic system of the spleen. Whether you are treating on the right side, that you are treating to the pancreas as per the dermatome, because the dermatome which causing from the thoracic 8 region, that energy passes to the spleen not on the left side but that is on the right side. So therefore the spleen meridian is existing on the left side, the pancreas meridian is existing on the right side, because that nerve is passing to the pancreas on the right side. Now let me start. This is I selected on the left side, that indicating to treat for the entire lymphatic system as well.
For all meridians it's the same bilateral, but
only this meridian is like this, the spleen meridian. Spleen you wanted to treat, then select on the left side. When you wanted to treat the pancreas, then you select on the right side. But now let me start. Spleen 1 we applied, but the points spleen and then pancreas points more or less is totally same, but there is no much difference. But now we activate the spleen 1. So now this point is the great point to treat for the much more indications. You remember any kind of the emergency, here spleen is indicating as a diabetes and also non-diabetes and metabolism, digestion and lymphatic system collectively can be treatable this point. When we wanted to use this point, that time you recognize there is a nail matrix related problem or the related to the any kind of the inflammation infection. Now how to recognize that? As I told you, is the lymphatic system point, but the lymphatic system, the drainage system is not functioning precisely. That time when there is the albumin level get changes in the body system. Albumin level is indicating some kind of the proteins normally we take, or we take as a dairy products, right? Much more we take, or the paneer we take, so that metabolism to be taken place precisely. When that will not happen, then the albumin level going to increase in the body system, that causes the urination passing through urine, that also kind of the cough urine is coming out. Along with that, sometimes of the white discharge also coming through the urethra. So that situation for the albumin metabolism to be taken place by activating this specific point. Along with that, if there is any problem is the hyperdiabetes mellitus, even on that situation also you can use it. But by the way, there is the fatty metabolism conditions also advisable to use this point. The second point to be known as a spleen 2, where exactly this point is located. So there is the anterior and then inferior. Remember AI, artificial intelligence. You keep it in the mind. So AI, that means A means is anterior, I means inferior. So now what is anterior and inferior? Anterior means is the front, inferior means is the below. Now this is you touch to the metatarsal bone. You touch to the metatarsal bone, you come down. You come down. Once you come down, then you can find the anterior depression, inferior depression, that indicating there is a thought that is a spleen 2 point. Is advisable to apply this particular region. You just touch and then feel, touch and then feel, you apply here, but there is no second point here, but the point is located is here. Apply here is spleen 2. Yes, spleen 2 you just activated, that is the Thatu. Then the spleen 2 is equivalent to the H7 and then P7. H7 and P7, both the points is equally treatable for the heart energy. It comes to the spleen according to the 5 element theory. Whenever we talk about the 5 element points, that time always you should have the 5 element theory in your mind. Right, spleen 2 is the fire and then earth connecting point. So therefore, whenever there is the hypertension or the palpitation or the GIT related disorders or something connected to the heart having more function and metabolism is not good, that situation you wanted to use, you can use a spleen 2 point. By the way, spleen 2 is the good point to treat for the white blood corpuscles. You remember the WBCs, when there is the, yes, when there is the white blood, when the white blood corpuscles are deficiency, the immune system is very poor. When the patient lot of cold and congestion and phlegm and asthma repeatedly, they are getting the problem. Remember, this is a very key point. You are treating for the asthma by using the lung meridian point, but it's not like that. But you wanted to use the point that to be known as a Thatu is very important point, that to be known as a spleen 2 to treat for the asthma, because the phlegm is related to the what condition? Because the phlegm is the fluid is retention is there in the spleen, that the transportation and transformation is not happening in the body system. Due to that reason, it causing the phlegm retention that will going to accumulate in the container, that to be known as the lungs. Where is the production? Production is the spleen. So therefore you wanted to treat for the spleen to improve the immunity level, consciousness level, and further there is the again shouldn't get the cold and congestion and asthma related problem can be treatable by using the spleen 2 point is very good point, because it increases the white blood corpuscles. When the immunity, what is the normal blood count of the WBC? Minimum is 4,000 to 11,000. 11,000 per cubic millimeter. So that should be required. If it is not there, that causing the much more problem. So therefore you need to activate the spleen 2 is always is good. Then the spleen 3. By the way, spleen 2 also good to treat for the above the diaphragm. Anything related to the above the diaphragm having the problem, any kind of the pain on this region, any infection, pharynx, larynx, cold, congestion, asthma, and also there is some kind of the breathing difficulties or the haziness, the brain related infection, also advisable to use the spleen 2 is good. Then you wanted to treat the spleen 3 point. Spleen 3, yes, posterior and then inferior. First try to find out. So touch and then palpate and then feel. This is the metatarsal bone, head of the metatarsal bone in the depression. In the depression, there you can find the spleen 3 point. So always you need to find out the depressions to treat the acupuncture point. Yes. H7, P7. P7, pericardium 7 and then heart 7. Now we just apply the spleen 3 point is the horary point and also it is the earth point. This is the fire point and this is the earth point. This the earth point is the really good to treat for the spleen itself. Spleen, any lymphatic system related disorders successfully can be treatable by using the lymphatic system liver 3, that is spleen 3 point. Spleen 3 is the great point to treat for the metabolism of the carbohydrate metabolism. Spleen 2 is the good for the uric acid metabolism. Spleen 3 is the good for the carbohydrate metabolism. That means it's good for the digestion and also good for the diabetes mellitus as well by activating the point. When you wanted to use the diabetes mellitus, which side you need to apply? On the right side you need to apply, not on the left side. So therefore you just apply on the, but however you are applying bilaterally or the unilateral, use on the right side, but better you can use on the left side to treat for the whole below the diaphragm or the lower limbs having any kind of the infection. That infection can be treatable by activating the spleen 3. Spleen 3 also good point to treat for the red blood corpuscles having the deficiency. ESR get changes drastically on that situation, any kind of the infection. So what is the normal red blood cell count? 4.5 to 6 million per cubic millimeter, right? So in that situation, per cubic microliter, per cubic microliter. So therefore 4.5 to 6 million is required. If that is not there or the low or the excess, even that condition we can use the liver, spleen 3 point is good point to treat for the red blood corpuscles, and the spleen 2 is good point to treat for the white blood corpuscles, and also the uric acid and carbohydrate metabolism to be taken place. When the uric acid metabolism is taken place precisely, on that situation the gout related problem or the uric acid level get excessiveness, that causes the especially pain on the elbow on this particular region of the great toe. So that situation, the purine derivatives called as the crystal formation will going to happen in this region, that causes the more pain and pathetic situation on this region. So due to that reason, I recommend you anywhere there is a uric acid get excessiveness, on that situation you can use the 1 point that to be known as a pericard, and that is spleen 2 point. Spleen 2 for the uric acid metabolism. Diabetes you can use it as a spleen 3. Now coming to the spleen 4, that is the Kung Sun. Kung Sun means is the grandfather and then grandson. Now from here you can place it is the One Chun superior. You try to find out the bone. So this bone to be known as that is the first base of the inferior margin of the metatarsal bone. The first metatarsal bone, base of the first metatarsal bone you can find. You give the pressure from here and then you can find the hollow depression. That hollow depression, all of you in the Zoom, please try to find out the proper location. You will come to know. Then you just give the spleen 4 is the great point. Now I'll tell you the one secret. So anyone, you just apply the spleen 4. Spleen 4 on the left side. On the left side, spleen 4 is good point to treat for the fat metabolism. Right? Fat metabolism to be taken place precisely good. The people who have the TG, triglycerides get excessiveness, or the total cholesterol get excessiveness, the low density lipoprotein, LDL get excessiveness. On that situation you wanted to use, you can use the spleen 4 to the downwards direction. You can palpate and then apply. This very good point to treat for the cholesterol as well, because it is a lipid metabolism to be taken place. One more secret, as I told you, this is the Chung Mai. Chung Mai meridian is known as the mother for all the meridians of the 8 extra meridian. So that particular time you can use it, this point precisely good to treat for all the pelvic related disorders. Remember, the Professor Anton Jayasuriya has written in his book, this is good point to treat for the acute diarrhea. So diarrhea, people says 10 times, 20 times, 30 times I passed the diarrhea in a day. Even that situation. So we wanted to give the pressure, or you just apply the needle on this region and do the moxa in this region, because the coldness get excessiveness also reason to cause that problem. Then you just apply this needle to the spleen 4 is good point number 1. Number 2, as I told you, all the reproductive system related conditions can be treatable by using the spleen 4. So therefore the Chung Mai meridian, The Chungmai meridian starts from this region, ascends to the upward direction. Therefore, it's advisable to use the spleen 4 is a good point to treat for the reproductive system disorders, especially for the infertility condition also can be treatable by using the spleen 4 point if you give the moxibustion to this point. Then further, this is a very great, that's the reason the Huangdi is the grandfather and then children, grandson. So that name itself they kept as the Kung Sun, Gung Sun. Gung is the one name, Sun is the another name, the grandfather's grandchildren name. That to be known as a Gung Sun. They kept my grandchildren name I kept for the spleen 4. The cheapo is explaining about this name. That means so important and powerful point in the spleen meridian. But I think Professor Dr. C.K. Raju also says spleen 4 is my favorite point. He also used to apply this, spleen 4 moxibustion is good to treat for the numerous diseases. Right now, come to the spleen 5 point is I think the South Indian father of acupuncture, and Dr. Siddiq Jamal and Fazlur Rahman. This is the favorite point to be known as a spleen 5. Let me see, give me that marker. So how to do that procedure? I'll show you how to locate this point. This is the medial malleolus. This to be known as a medial malleolus. Just you do the below you just come down, you just draw the one line, draw the vertical line. Draw the vertical line, you draw the horizontal line. So there are the two lines. This is the medial malleolus, lower portion, horizontal line. Then the tip of the medial malleolus, and then vertically lateral. That means is the outer side of the malleolus. So now both the points were meeting point to be known as a spleen 5, right? Anterior to the depression of the medial malleolus to be known as a spleen 5. So therefore spleen 5 you just apply yourself. So this is in fact is a great point. Spleen 5 is equivalent to the which point? LU 9 point. There is no pain, right?
She's very brave. It's not painful. Yeah.
She's asking something.
Yes. Is it painful or not?
No, it is not. No,
Right.
I'm practicing as an intern. I'm putting for all the patients. Why don't I try myself? That's why I tried today. I think I'm okay. Every time I'm putting for others at home, we have to do it. No, I can't ask. My daughter says I'll come and put it for you. But sorry.
Now, just this is the sun point. Spleen 5 is the sun point, sedative point, and also this is the metal point and earth point. So therefore, spleen 5 is the great point to treat for the all the venous system meeting point. Veins are meeting point. Inferior vena cava or the any kind of the superior vena cava, saphenous vein, popliteal vein, peroneal vein, all are connecting point to be known as a spleen 5. That's the reason this is the meeting point they told. But in that way, this also good point to connecting of the junctions. What is the venous system? The capillaries. Arteries will become the capillaries. Capillaries connecting to the venules. Venules are connecting to the veins. Veins are connecting to the major vein, that is the inferior vena cava. So therefore, internally connected this point. So therefore, spleen 5 is the good point to treat for the blood vessel related disorders. Blood vessels that will become the veins, isn't it? So therefore, you can use spleen 5 for the varicose veins related problem and also the lungs related disorders, even actually the throat related problem, especially hoarseness of the voice or the children difficulty to speak. As a supplementary, you can use it. This point will be supportive point to treat for the voice related issues as well. Along with that, you just add up the voice K6 point as well. Kidney 6 is a good point to treat for the voice because LU7 K6 is the combination. Now let me see, there is another point is the most daily practice. We can use it from here to here. How many chun? 13 chun. From here to here is 13 chun. From here to here is 16 chun. Right. Now from here to here, how many chun? 13 chun. How many chun this is? 6.5 chun. Right. This is the 6.5 chun. From here to here, this is the tip. How many chun? This is the 3 chun. 3.25. Yes. Now this is a spleen 6. 3 chun proximal from this is spleen 6. Please apply somebody. Good. So now spleen 6 is the point. Yeah, perpendicular you just apply. Spleen 6 is the point where exactly there is the junction. This the entire region to be known as a junction. Normally for the day-to-day clinical practice, we used to apply the spleen 6, the spleen, liver, kidney. So 3 also connecting point. The spleen starts from here, kidney starts from here, and then liver starts from here, but it intersects on that region. It merges the energy on that region. From there it ascends to the various direction. There is a meeting point. Now we can recognize the Bengaluru is the spot where the Delhi train also comes, stays here, and then reaching to the Chennai. From the Chennai to the Calcutta that's going, that through the Bangalore it's going, that the Bangalore that will going to stop from the Chennai to the Bengaluru and then Calcutta, and then further there is a one more train is coming from the Mumbai, then that's going to the Trivandrum, then that's coming and then meeting on the junction, that is the Bengaluru. So in that way, so one specific junction to be known as all the 3 states, that means not the 3 states, from the Delhi to Bengaluru, Madras, so many states incorporated. Likewise, the spleen, liver, kidney, the junction is there in this region. So therefore you need to activate, you just increase the energy upward direction, or you want it to decrease, you can decrease the energy on the lower direction of the spleen. So therefore spleen 6 is a majorly good point to treat for the, especially for the diabetes mellitus and also for the overall health, especially for the blood related disorders. Remember, the pelvic blood related disorders can be treatable by using this point. That means the blood, what kind of the blood? The bleeding is happening more. The blood is not controlling. On that situation, you can use it to stop the bleeding, also advisable by using this point. So hopefully you understand spleen 6 for the known and unknown cases. This is the most distal point in our body. How the LI4 is the distal point for the face, and this is below the navel. Below the navel, this is the distal point is spleen 6. Any kind of the known and unknown problem can be treatable by using the spleen 6 as a local point. That means the distal point, you can use it to treat for the lower abdominal pain or the bleeding or the menses is not happening or anything is the infertility conditions, and also there is a varicose veins is a very good point to treat for this. But normally varicose veins, why we use as a spleen 3 and then spleen 6 points? Because you remember the muscles. These muscles called as a soleus muscles. These muscles called as a gastrocnemius muscles. These muscles called as a ATM muscles, anterior tibialis muscles. Now, if these muscles, particularly this, the inside of the muscles, there is a walls are there. That walls get the stagnation, walls get the blockages. Due to that blockages, the chi flows, the blood flows to the upward direction is not happening, and that will going to obstruct over in this region, that get the stagnation and then blockages in terms of that get the bulges. Due to the bulges, that causing the problem of the varicose veins. In that situation, what we should do? So we just increase varicose, C-O-S-E. Anything COSC is coming, that time is the deficiency of the muscles. So now what you should do, you should increase, not the sedate. What you should do, you just increase the upward direction. Then spleen 5, you just increase to the upward direction for the varicose veins. Rather than downwards, what you should do? Upward direction. You wanted to sedate, you can sedate downwards, but you wanted to increase. Sir, ये सब समझ में कब आएगा सर? तो अगर समझ में नहीं आ रहा है, then you just apply perpendicular. Nothing to worry. The body knows what to be done, isn't it? So इतना भी हम confused नहीं. हमारा काम हमें करना है. पर भगवान का इच्छा होता है उसको ठीक करना है. लेकिन you just activate to the upward direction. This is for the varicose veins is always is good. You are in dilemma, you just apply perpendicular. Now there is another point is locu. Locu is again 3 chun proximal to this point. So this to be known as a border. The posterior border of the tibia or the medial border of the tibia. कोई book में लिखता है कि medial border, कोई book लिखता है the posterior border of the tibia. लेकिन जो भी हो medial side and the posterior border दोनों मतलब same है. तो इसीलिए आप जब भी बॉर्डर देख लो, टिबिया का बॉर्डर देख लो, दिस इज द आउटर साइड बट दिस इज द इनसाइड. The inside of the border of the tibia that's called as a shin bone, but उस बॉर्डर के अंदर लगाना है. बॉर्डर के बाहर लगाएंगे तो वो किडनी मेरिडियन हो जाएगा. अगर आप अंदर के हिस्से में लगाएंगे यानी ये बोन के तरफ, वो लिवर मेरिडियन हो जाएगा. इसीलिए आपको बॉर्डर के इमीडिएटली बॉर्डर में आपको लगाना है. तो हाउ टू डू दैट? सो यू टच एंड देन फील. ये इतनी दुबली है, पता ही नहीं चल रहा है वो लगा.
How do we find out?
That's what I told you, the pressure. ठीक है. 1.5 cho needle is required, but hopefully see this is, you remove that, you take out that, find out the border, inside the border, next to the immediately border, immediately next to the border you just apply the spleen point.
This is the border.
Yes, border. Yes.
One time. Here also.
हाँ, बोन है ना, बोन के अंदर.
Oh, like this.
हाँ, बोन के अंदर बॉर्डर है ना. बॉर्डर के अंदर लगाना है. मतलब बॉर्डर है, बॉर्डर के बाद जो हॉलो डिप्रेशन मिलता है ना, उस डिप्रेशन में लगाना है. होप आई एम क्लियर टू एवरीवन. राइट.
सर ये अभी जो डिप्रेशन, सर ये जो टिबिया बोन है सर, उसका आउटसाइड है ना सर, एक्सटीरियर आउटसाइड है ना सर.
हाँ जी.
तो उससे उधर इमीडिएट नेक्स्ट लगा तो स्प्लीन मेरिडियन है, और इनसाइड आ गया तो उस साइड आ गया तो कौन सा मेरिडियन है?
किडनी मेरिडियन. इस साइड किडनी है, इस साइड लिवर है.
तो ज्यादा डाउन आ गया तो किडनी.
हाँ, किडनी आ जाएगा. इसीलिए वो बॉर्डर में ही लगाना है. जितना बॉर्डर मतलब आके जो बोन है, बोन आपने पैल्पेट करो, आप पैल्पेट करो बोन है. बोन के ऊपर अगर लगाएंगे, बोन के थोड़ा इधर लगाएंगे टुवर्ड्स स्टमक मेरिडियन के तरफ, वो लिवर आ जाएगा. तो फिर जितना आप बॉर्डर आपने टच कर दिया टिबिया को, तो उसके बाद जो गड़ा है, डिप्रेशन है, हॉलो, उस गड़े में डायरेक्टली लगाना है. अभी बोन को लगाएंगे तो हाफ चू नहीं लगा सकते हैं. अगर यहाँ पे अगर हॉलो स्पेस में लगाएंगे तो फिर आपने 1.5 चून भी लगा सकते हैं. तो बोन में नहीं लगा सकते, ये लगा सकते हैं. हमने लगा दिया. दूसरा पॉइंट मैं दिखा देता हूं, वही पॉइंट क्यों लगाऊं. तो स्प्लीन 8 पॉइंट. सो स्प्लीन 8 पॉइंट, हमने स्प्लीन 9 हमने सेलेक्ट कर दिया और 3 चून बिलो.
और पास में ले लो, इसका ही नहीं देगा.
हाँ.
Can I cry?
अभी स्प्लीन 9 पॉइंट हम देखेंगे. स्प्लीन 8 तो मैंने लगा दिया, दैट इज द सीक लेफ्ट पॉइंट ऑफ द स्प्लीन. और अब हम लगाएंगे स्प्लीन 9 पॉइंट. एग्जैक्टली फॉर द डे टू डे क्लिनिकल प्रैक्टिस के लिए हम लोग इस्तेमाल करते हैं स्प्लीन 9 पॉइंट. दैट इज द इन लिंक चुआन. सो स्पेशली दैट इज द ग्रैंड सन पॉइंट है, सेडेटिव पॉइंट है, और इट इज द लास्ट पॉइंट ऑफ द स्प्लीन मेरिडियन, दैट इज द वाटर पॉइंट. सो अभी इसको वाटर पॉइंट को हम लोग किस तरीके से एक्टिवेट करें, तो फिर आप देख लीजिए कहाँ पे ये पॉइंट है. तो मुझे यहाँ से टच करके लेके आना है. यहाँ पे मुझे टच करना है. सो बॉर्डर ऑफ द टिबिया, बॉर्डर ऑफ द टिबिया, बॉर्डर ऑफ द टिबिया. जब आपका उंगली स्ट्रेट जा रहा है, जिस जगह स्टॉप हो रहा है, सो दैट्स कॉल्ड एज ए इंफीरियर टू द tibial tuberosity. inferior border of this is the medial border. ये medial border of the knee हो गया, medial border of the knee, and then further the inferior medial tuberosity of the tibia. तो ये पॉइंट है स्प्लीन 9. इसका मतलब यहां से आप आराम से हाथ लेकर जाइए. जिस जगह आपका हाथ स्टॉप हो जाता है वहां से उठता नहीं है ऊपर, वहां पे स्टक हो गया, तो उस बिंदु का नाम है स्प्लीन 9. सो somebody you just apply spleen 9, that is a grandson point. हाँ जी. सो वी जस्ट अप्लाई 1 to 1.5 टोन, स्लाइटली उसको सेडेट कर दो, स्लाइटली उसको सेडेट कर दीजिए ताकि वो ग्रैंड सन पॉइंट है, सेडेट होता है। जितना डैम्पनेस और ह्यूमिडिटी एक्सेस रहता है शरीर में और मेंस्ट्रुएशन प्रॉब्लम रहता है, पीरियड्स रेगुलर नहीं होता है और स्वेलिंग होता है, तो इसके लिए महत्वपूर्ण पॉइंट होता है ये स्प्लीन 9 लगाते हैं तो फिर वो एनर्जी लेवल डिप्लीट होता है। और जितना ये टॉक्सिसिटी एक्यूमुलेशन हो गया है, जो डेड सेल्स यहाँ पे मौजूद हैं, वैसे सिचुएशन में और स्पेशली फॉर दी रीनल एडिमा, पिटिंग एडिमा, ऐसे सिचुएशन पे भी स्प्लीन 9 पॉइंट लगा सकते हैं। और खाना खाने के बाद फुलनेस ऑफ द स्टमक, इन दैट सिचुएशन वो रिटेंशन ज्यादा समय हो रहा है, ट्रांसपोर्टेशन नहीं हो रहा है, तो फिर स्प्लीन 9 इज इक्विवेलेंट टू द K3, हमारा फ्लूइड मेटाबॉलिज्म भी हो जाएगा, फ्लूइड एक्सक्रेशन भी हो जाएगा। स्प्लीन 9 इज द ग्रेट पॉइंट टू ट्रीट फॉर द वेरिकोस वेन्स एंड आल्सो स्वेलिंग कंडीशन। लेकिन यहाँ पे 3 पॉइंट्स ऐसे हैं, एक स्प्लीन 9 है, स्प्लीन 7 है, स्प्लीन 6 है। ये तीनों पॉइंट्स हम लोग ट्रीटमेंट करेंगे डायबिटीज मेलिटस के लिए। जितना हम लोग डायबिटीज के लिए ट्रीटमेंट करना है तो फिर इसमें बताते हैं कि जितना अगर 400 ब्लड शुगर है तो फिर 50 to 100 इसमें कम हो जाएगा, विद इन शॉर्ट पीरियड में कम हो जाएगा। तो फिर स्प्लीन 6 और स्प्लीन 7 and spleen 9, 3 points also good point to treat for the control the diabetes mellitus, but within short period में when you apply the needle, after some period of time patient feel the lot of changes. So